Thank you, Chairman. I have reviewed the minutes from our August meeting. I find them to be in order, and without objection, I move for their approval.
Second.
All in favor say aye. Any opposed? Thank you. The second item on our agenda is public comments, and to my knowledge, as of 4:30 p.m. today, no one had signed up. So anyone in the community, next month until 4:30 p.m., the day of our meeting, you can sign up for public comments. And next, to deviate from the agenda briefly, I see Austin Maxwell from City Council. I see Claire Maxwell, Cole Young, Sheila Bratton from the school board. So thank you guys for being here. I know we have a lot of items. Also, I'll call the roll momentarily. Thanks for that heads up. I'm calling the roll of the audience first. Carolyn from Stewart's Creek High School, a senior at Stewart's Creek, just wanted to see how we do business here tonight. So I congratulate you for devoting some time to this. Thank you. Having said that, we'll get down to real business. If Rachel, if you call the roll.
Yes, sir. Commissioner Oliver?
Present.
Commissioner Davidson?
Here.
Commissioner Wilson?
Here.
Commissioner Boyd?
Here.
Commissioner McMurray?
Here.
Commissioner Gooch?
Here.
Chairman Dodd?
Here. Thank you. Thanks, guys, for keeping me on track. By the chairman's prerogative, school board director Dr. Sullivan has a personal scheduling conflict, and he's requested that the school board items be moved to item number 3. So the school board, without objection, is going to move up. I've informed the health department and others who are further down the agenda. So without further ado, Dr. Sullivan, we are on item 6 on your agenda, folks. Under school board, and on the SharePoint, we have 2 documents, document A, budget, and document D, LHS update. And what we will do is your clicker. Do what? I noticed IT moved the laptop around. Sorry, guys, I had a little technical difficulty here. Bear with us a moment.
Me to do Lavergne High School refurbishing update first?
Sure,
Because
sure.
I would need to pull up the budget amendments and that kind of stuff to be able to read from.
So we're moving on to item D, which is
That would be perfect. If you don't mind, that'd be perfect. All right, so we want to go back to the school board now to the budget amendment?
I do indeed. So
That sounds great.
item 6A, BOE budget amendments.
So thank you guys for, especially for our people that I had to bump line. I apologize. I've never had to do that before. But I do have, we've had a meeting every night except last Friday, so I believe in transparency. And my son has his last baseball game of the entire year, and I've missed the last 4. And so I said, please, it ends at 7. Let me at least see him bat 1 time this school year. So that's what I'm working through. So thank you guys for doing that. So let's do our budget amendment first. So our budget amendment, you will see that each July 1st, outstanding purchase orders in Fund 177 are liquidated. The funds go to fund balance, which in this fund is account 34685, committed for capital projects. These purchase orders are for projects that were not finished by June 30th of last year. This amendment takes those funds out of 34685, committed for capital projects, and rebudgets the expenditures for the carryover projects that were approved last year but haven't been completed. This year, we have $13,577,898 in funds to rebudget. Recommended motion to amend the 23-24 capital projects budget fund 177 by reducing account 34685 committed for capital projects by $13,577,898, and by increasing maintenance and repair services building account 91,300, 335, other contracted services account 91,300, 399, and building purchases account 91,300, 732 for a combined total of the same $13,577,898 as presented. Again, these are just a allocation of the same projects. You have an updated sheet just for your own knowledge. These are the same projects that were included last year that we did not finish by June 30th that are rolling right back into the same account.
And Rachel just asked, that's this sheet that's on your desk? It has some colored highlights.
Dr.
Chairman
Sullivan,
Phillips?
could you just explain capital projects versus maintenance?
Yep, happy to.
Are they in capital projects, and how can we move them out of that?
A lot of it has to do with our accounting department and what Jeanette talks with the courthouse about where they want them, being completely transparent. But capital projects is looking for truly those things that are going to be above and beyond your day-to-day maintenance that we are looking for. So whether you're looking at HVAC is where a huge portion of ours, or roofing, or those different types of things.
And Dr. Sullivan, this is something that I would say comes back each year around this time. It's another kind of cleanup where funds go back in that aren't spent. So this is something we would see at this time every single year, likely, correct?
Correct, and I want to give Trey and our department a shout out. So the way this fund works, Fund 177, is largely funded out of property tax. And so if we didn't have a healthy fund balance by moving these back over, fund balance in that account after moving this is $5.86 million. We need that to be able to operate. For example, most property tax isn't going to come in until December or January. And prior to Trey and that leadership, you truly would be sitting waiting for a property tax bill to come in, and then they would call our department and say, you have $100,000, which project do you want to hit? And so this is part of that same line of, we don't receive all the funds until later in the year, so we're not going to be able to spend all of those.
I'll entertain a motion.
Question.
And that will prompt more questions as well, and questions.
So you're saying these funds were allocated last year but not utilized? These projects are still left undone?
Yes, that's
So
correct.
then, are those projects not going to be completed, or?
No, so
Could you explain that again for
Yeah.
me?
To the contractor, they have no knowledge of that money having to go from one fund to another. But for us, on a fiscal year, our fiscal year ends June 30th, and so they may have a project still outstanding, or they're waiting on supply chain, or waiting on contractors to be finished. We have to move that money back because June 30th ends our fiscal year, and then we have to come back before you and ask to move it back into so that we can actually pay the bills for what needs to be done.
Thank you.
Of course.
Mr. Chairman, motion to approve as presented.
Do I hear a second? Second, Mr. Boyd. Any further discussion? Roll call vote, please.
Commissioner Gooch,
Yes.
Commissioner Oliver,
Aye.
Commissioner Davidson,
Yes.
Commissioner Wilson,
Yes.
Commissioner Boyd,
Yes.
Commissioner McMurray,
Yes.
Chairman Dodd.
Yes.
Motion passes.
Thank you. Director, if you would continue on to enrollment update, please.
So just a quick enrollment update. I reported to Health and Education last time that we did have several hundred students who were dropped out of our rolls because they didn't either provide proof of residence or because they moved out of the area, and it takes, when you have a student that moves to another state that doesn't start till after Labor Day, we a lot of times won't get those withdrawal forms. So our enrollment was 50,820 as of last week. That is kindergarten through 12. So 50,820. We've grown about 800 students since this time last year, and so right under 2%, but still hitting that trajectory of looking right at 1,000. Luckily, the 1,000 is not the 2,000 that it was the year before from a school system standpoint. And then the other portion with enrollment, our zoning capping for Stewart's Creek Elementary School that we talked about last time. I want to thank Commissioner Wilson. I've met with MTAR, I've met with several different groups, worked on just some collaboration between our groups so that the messaging was consistent. So I appreciate you inviting me to do that.
I want to acknowledge Mr. Wilson on that as well, that Commissioner Wilson got the local real estate group, the Middle Tennessee Association of Realtors, together with the director to start collaborating on the difficulty of placing schools where we don't have infrastructure. When you place a school outside of this building plan, now we're having to move schools because the population has shifted. So thank you for putting those two parties together. So the enrollment update, I believe, was informative. We'll move on to Dr. Sullivan, the rezoning. Is that
is.
squared away with that?
It is. So rezoning, we are about 14 months into our entire rezoning plan. So this began with, we decided again to hire a third-party consultant to give us an outside view of what our district is and where we have growth, where we have challenges, and just truly give us that outside perspective, outside of politics and just the way that our county has grown, give us that outside perspective. First part of that, as a reminder, was looking at enrollment trends to see what is our enrollment looking like. Their projections from last year to this year were just a couple hundred off. So their enrollment, unfortunately, showing us continuing to grow into 56,000 is exactly what we are trending at looking like as a district. Next section was truly coming up with a capacity for each one of our schools. And so they visited each one of our schools, and we have worked through just that capacity at each campus to see a working capacity. The other part of that, and we've mentioned it a couple times here, was so that all of our buildings beginning next year have an agreed upon kind of operational framework for if you are kindergarten through fifth grade, you need to put all of your kindergarten through fifth grade classrooms in brick and mortar before you put them in a portable. And so just having that common understanding, and we've talked about that at Health and Ed. And then the last step is rezoning. So we launched with the media session on September 7th. I refused to watch news or anything else because every time I turned it on, there I was, and I didn't want to see myself anymore talking about rezoning. It was everywhere, a little traumatizing. But we had public input meetings Monday, Tuesday, Wednesday. Monday at Lavergne High School, Tuesday Stewart's Creek High School, Wednesday at Siegel High School. We, before the second day was over, already had 350 different people that had submitted public input. It was a much more efficient process because what we tried to tell people is that usually when you do rezoning, everybody shares their personal story. And that's perfectly appropriate, but personal stories still have a way to get a zone exemption, and that's through asking for a zone exemption and then appealing for the board for a zone exemption to that school. Talking about your personal story in front of everyone else isn't the most efficient. And so we really worked through some of that, got some good feedback. We hope to have new concept maps based on our feedback. That survey is still open through Friday. New concept maps by the middle to end of October so that our board can review the end of October. We have a board meeting November 7th and 9th that they can review, and then hopefully vote on our new maps for November 14th. So all of that to say our zoning is very much strategic and spread out over a couple years. Nobody necessarily gets rezoned next year outside of possibly looking at Roy Waldron Annex, moving to the Roy Waldron main building, and John Coleman and Lavergne Lake. The rest of the zoning depends on us having buildings ready. So elementary zoning won't change if we don't have a new elementary school on the Beatty property. There'd be no point in moving kids because there's nowhere to move them to. Elementary rezoning would go into place 25-26. Middle school zoning would go into place 26-27, which hopefully we would have a new middle school on that property. And then high school rezoning would go into effect 25-26 if the additions were ready. And so I think that's helped showing parents you have got about a year and a half to figure out where your different areas are going to be rezoned. And that's kind of our update. You do have an updated building plan. This is updated, but something I did want to definitely point out is that this is not board approved. So what do I mean by it not being board approved? The new elementary school, which we call West, the Beatty Elementary School, these are the exact numbers our board approved. They're not the true numbers, but my job is to bring what our board asks for me to bring forward. And so our board technically hasn't approved moving the Beatty property from last year to this year. We already know we're past last year, so it doesn't make any sense for me to give you a plan that shows something that didn't occur. We know that that's part of something we are going to be requesting hopefully in February, but by showing you, I wanted to show that it's in green because that new elementary school West got pushed from last year to this year. You'll also see that Blackman High School and then Lavergne High School, those numbers will have to be updated depending on what we want to do with those. I also have a new middle school West, realizing that to think $254 million would be funded this year is not realistic, but that is what our need is, and that's what we are going to start looking for, how to be strategic with our rezoning plans to be able to address some of this. But I wanted you to have a new one, but I have at the top, this is not board approved because technically they did not approve yet moving Beatty property from last year to this year. Happy to answer any questions on that.
Excuse me, Dr. Sullivan, so again, elementary West, You moved forward for to visual purposes.
Yes, that's it.
No land yet for the,
North end.
oh, the Middle School West it could fit on the Beatty farm.
It would be
Okay.
on the Beatty property, yes.
Blackman High School is an addition
Yes, so.
concept?
Yes, and we'll get into that as part of this. Originally, our board asked for 5 high school additions. We received funding for 3 of them. The next 2 are Lavergne and Blackman, and those are part of this year's official 5-year plan that was approved.
Land for North End is conceptual,
Correct.
and then the Lavergne High is an addition.
Correct. And I've shared this exact same thing. Met with Mayor Carr and Michael Smith early in August as well, going over these things, so that everyone was aware.
Big numbers.
Big numbers, yes.
I know that some of us made it to the rezoning meetings, the town hall meetings that came to the schools, and this was the document that derived from that. I just happened to, I've been thumbing through it, so I know this is available on some public platform. I don't think it's in our SharePoint, but I urge you guys, I know you guys picked them up at Lavergne the other week. Man, this is really interesting. It's the first time I've seen just data, unemotional data. Where are the bodies? What's coming? Just a very scientific approach, and this is fascinating. So I urge you to take a chance to look at that. And I think this segues in, if there's no questions of Dr. Sullivan, that when we met last week, I know some of our commissioners from Lavergne got to tour the building again and see the current status of things. We went over this, and I think that prompted some questions, Dr. Sullivan, that came out this week, which compelled me to put Lavergne High School update as a agenda item. So if there's not any questions about the rezoning plan, I may have been quick to do that. We'll move on to a question about Lavergne refurbishing.
I do have a rezoning question, because I'm really challenged at the fact that we're doing an expansion at Oakland only to rezone and decrease capacity. So can you speak to that for me, please?
Yeah, so ultimately that is when we're looking at our entire district, we have needs at all 5. And so if we go back to what our board, and do you mind if I move to my next slide? Is that okay? So I think that is very important. Whoop. Oh, I do this. If I hit it again, it's going to go forward.
Do we have access up here to any?
All right, so I think it's important for us to, because I definitely understand where that's coming from. We got that question nonstop, pretty much. So there's a couple things I wanted to address. First is that our board ultimately requested on January 29th, 2022, before many of us were in these seats, myself included, our 5-year building plan. You'll see I copied the minutes because I believe in data and wanted you to see transparently what we asked for. Unanimously, we asked for 5 additions. And so that was what our school board's request was. In February of 22, based on the county commission's request, we were asked to prioritize those over a 2-year period. And so that's where we got to the 2-year period for high schools, to where we moved into the prioritization portion. I don't think any of us wanted to prioritize because ultimately our request was all 5, which is why you see that we're back with Blackman and Lavergne still on this portion. You're asking to pick needs across all of our schools, as you'll see with our rezoning plan. Every one of our high schools is overcrowded and still going to be overcrowded. And so we're still going to need seats. Just to give you kind of some more data, and I'll get to the Oakland portion. So approval for year 1 high school addition, school board approval, was on April 13th, 2023. So that is when Riverdale, Smyrna, and Oakland were approved. We as a school board looked at then at that point, we realized that Lavergne still needed attention. And so we went with a little bit different of approach because usually we take this out of 177. And so on May 11th, our board approved the following motion unanimously. So Lavergne High hallway upgrade. Engineering Constructions reviewed the hallways at Lavergne High and request to provide funding from 22-23 budget to make repairs and replacements to the hallways. This includes replacement of all ceiling tiles, like materials, painting of the hallway walls with 2 colors, painting the hallway side of all door frames, and replacing the VCD flooring with LVT. Projected cost was $980,000. So let me continue, and then I'll come back to the question. So we then went to the commission for funding, and so we had quite a bit of discussion. This hit right at the same time of the Health and Ed joint meeting with budget, and so we were actually to attack it at the exact same time. So Health and Education passed it unanimously. Budget did not pass unanimously. We had a lot of conversation around using shared money from 177 to address some of our needs. I talked about this at the last commission meeting. Ultimately, we have more needs than we have funds. So we're trying to be as creative as possible to use our funds that we have instead of having to come and ask the commission. And so ultimately, we received approval there on May 23rd to then the budget meeting minutes as well. So just straight from the minutes. Got to the county commission, so county commission approval was not until June 15th. And so really as a school system, we couldn't do anything to Lavergne High School until county commission's full approval because that funding was coming out of 141. Now you'll see on some of the receipts, we knew this was coming, so quite honestly, we knew we had to get things done before the school year because June 15th is already 2 weeks into our summer. And so we went ahead and started moving on a couple of these to get our contractors moving. So being a budget amendment, just a couple other things. We had to wait for final commission approval, and that was granted on 6/15. Teachers returned on August 1st, so you're talking 45 days roughly. Our budget amendment request was for hallways, paint of hallways and ceiling tiles. Painting and flooring is complete. Ceiling tiles are not. So that was in July, I guess, when I said all of this was complete. That would be my error. Not all of this was complete. And so ceiling tiles will be completed after flooring by the contractor. To give you an idea of where that sits, that's probably going to take this entire school year to get finished and probably into next summer. We as last year were replacing part of Riverdale High School in one of their wings, the floor and the ceiling tiles. And if you look on the sheet that you guys approved as part of the budget, you'll see that there are ceiling tiles for Riverdale that still have not been completed from last year. Part of that reasoning is, yes, our maintenance crew can do some, but we need kids out of the building for us to be able to replace and demo those. So we will hit, hopefully the main hallway is what Dr. Hatchett, the principal, has requested for us to hit right in front of the cafeteria over fall break. Then we'll hit hopefully the main hallways going down from there over Christmas break. Spring break, we'll get as far as we can, and ultimately it's probably gonna be some of the summer till the entire school is done. One part that I'm extremely thrilled about, and I thank Trey and his team for doing it, is that all these were completed under budget. And so we allocated, with you all's approval, $980,000. We were able to get some other things. So water fountains were unfortunately, you guys know I believe in transparency. When the school, rightfully so, wanted the water fountains taken down so that they could paint behind them. And in doing so, the water fountains are no longer operational and they got thrown away. And so we've had to replace the water fountains. And so we were able to take care of some of those things. Other things we were able to do, so interior signage was that same thing. It got thrown away when we were looking at it from making sure we could paint behind those. And then replacement of some hallway doors. As soon as you walk in, you'll see the doors were in really, really, really bad shape outside the cafeteria. Auditorium, a couple of those have been replaced, but we need to move on down to the gym and through the rest of the auditorium to replace those. And that still leaves us $195,000. And talking to Dr. Hatchett on Friday, we're going to start going into classrooms as well to replace ceiling tiles there. What you're going to see at Lavergne with ceiling tiles is honestly what you're going to see in a lot of schools if your principals haven't asked for it. And that's no, I'm not saying that's the right way to do it. That was decades and decades of operations of our school system. We have systems in place now by meeting with each principal as a budget process and going over what's the condition of your school with pictures that we take of your school to try to alleviate that, because it shouldn't be up to a principal stating what condition their school is in before we make repairs. And so we're dealing with something similar at Roy Waldron Annex right now. We dealt with something similar at Riverdale High School. That's the unfortunate part that we're trying to fix. So I wanted to kind of go over the renovations progress, and then it was requested. I don't know if I have any. Last portion just shows you an overall breakdown again of the cost. So that is just an overall overview of what the all costs were, showing you to the penny what each thing cost and how much money we have extra. And then the very last portion was going to be, of course, now it goes up everywhere. And the very last portion is kind of our next steps. So next phase of the 5-year plan, we've talked about, does Lavergne High School need an addition or not an addition? Talked to Dr. Hatchett on Friday, and then ultimately it'll be up to the school board to send this proposal forward. But originally that wasn't a request. But in looking at the number of kids that are going to be in that area, we're not going to have a high school open in time for us to be able to accommodate that many students between there and Stewart's Creek. And so that's probably an area that we have to look at going ahead and looking in addition for. Is that the best solution long-term? Probably not, because we're still going to need an additional high school there. But we don't have, one, the county doesn't have the funding to be able to build a brand-new high school, and two, probably most importantly, we don't have land to build a high school on right now there. And so we can't wait in order to do that. And so you'll see the other factors we have to look at is that a couple of the feeder schools for Lavergne High School are shrinking despite what our enrollment numbers are looking like. Lavergne Middle School got an addition 2.5 years ago, and so Lavergne Middle School, since that addition opened, has declined in enrollment. What our zoning numbers show is that there are more students living there, but they're not coming to school. And so we need to figure out where they are. Ultimately, they don't have to report it to us. If they're not coming to a Rutherford County school, they don't have to report it to us. So it's a little bit hard to figure out where they went. Lavergne Lake is similar. Lavergne Lake has shrunk by about 160 kids over the last 5 years. Every year we keep taking teachers and moving them throughout, but Roy Waldron's growing. And so there's some anomalies there that we have to try to figure out what's happening. Ultimately, get back to the Oakland question. So you go back to the Oakland question, we have to look at making sure we can fill seats. It was the will of the school board and then the will of the commission to fund those. And so my job then is to make sure that I fill the resources that we have. And those seats are being filled with our constant rezone. You'll see that they're over 2,500 and 2,600 with any of the concepts that we have. That doesn't address the need that we still have to have more seats at Lavergne, Stewart's Creek, Blackman, and Riverdale, and Oakland. They all still need new seats, so.
And I know in this, there was a 11% decrease in the Oakland zone.
That's what I was going to ask.
Is that referencing housing starts? Is that looking ahead, or is that looking back?
That's referencing housing developments, those different types of things with enrollment. So knowing that that area had an 11% decrease in just students that are living in that area, our job then is that, one, as a county commission, you guys funded different things. We have to make sure we're utilizing those seats. Same thing for John Coleman. John Coleman has 400 extra seats. We've got to utilize those seats. Plainview has seats. We have to utilize seats before I feel comfortable coming and asking you for additional funding for something else.
So you're saying you will be utilizing the 2,500 seats
Absolutely.
at Oakland High School?
Absolutely, without a doubt.
Because when I went to the rezoning meeting and I saw that, it just,
Absolutely, yeah.
It jumped out.
We had
Yes,
the same,
it
we had the
jumped
same
out.
question. In both plans, one uses, I think, John Bragg Highway as a dividing line. One uses Bradyville Pike as a dividing line. One was 25-something, one was 26-something. So we knew that if those are the seats that we have to use them. So 100%, yes.
and my next question was, what is the reason for closing the Roy Waldron Annex?
Yeah, great question. So Roy Waldron
What was the
Annex.
question? Closing
Why
it?
closing the Roy Waldron Annex?
So a couple, one, and I don't want to get too far in the past, whether or not we should have ever removed that from Lavergne Primary, I'm not sure we needed to. It had some logistical challenges because you have kindergarten, first grade in one building with no accountability, and then all the students went to second, third, and fourth. We tried with 2 principals to make that work. That didn't work very well either. And so now we have Dr. Jackson that is over one. One building is in much different shape than the other. And so when we're looking at potential renovation cost, I'm not sure the renovation cost outweighs the benefit for what we would be able to educate our students in at Roy Waldron, Lavergne Lake, and John Coleman. And so I'm actually going tomorrow. I'm visiting tomorrow at 11:30 because Dr. Jackson wants to show me some areas of the school that she feels like are in disrepair, and I want to see them for myself to see truly what kind of shape are we in. So that's the reason, because ultimately we either need to go back and revitalize that building or use our available seats that we have in the other areas. So.
Any other questions regarding the I think we've got two topics kind of rolling. I think it'd be fair to entertain both. So rezoning and Lavergne refurbishment.
So relative to Lavergne High School renovations, they're still underway, basically.
Yeah.
So that was my challenge, because prior to school starting, we got the message that it was all complete. And so that's why last week was my first time getting a chance to visit, and I was just like, wait a minute, doesn't look complete.
That was my error in the ceiling tiles. I was so excited. I know you probably visited that school last year. By going in July, we had a meeting, and I was so excited the way that the floors and the paint looked. I didn't look at the ceiling tiles, and I was there that exact same day. So there's the error that's on me for saying that was complete.
And my tour last week with Dr. Hatchett, we do need to look at lighting too. That dark color just sucked the light right out of those halls, didn't it? So that was a point of reference that we shared last week.
In the future, the commission may get some LED lighting packages to look at, and I'm not going to look at Michael Smith during that moment that I just brought that up.
So thank you, Dr. Sullivan. I will entertain a motion to approve Dr. Sullivan's entire report.
So moved.
Second. All in favor? Any opposed? Thank you, Dr. Sullivan.
Thank you, commissioners. Thank you, school board. You guys for being here. Appreciate it.
All right, we can move to Health Department. Would state your name and title, and we'll.
Byron Cumby, I'm the director of your Rutherford County Health Department. Hopefully you have your outreach report there before you. Your health department does continue to do good work for the people of Rutherford, and we are indeed proud to serve. In keeping with our mission to protect, promote, and improve the health and prosperity of people in Tennessee, as we protect in that first column with our disease intervention, immunizations, and environmental health. In the center column, we promote with our health outreach, diabetes outreach, community participation, and vital records administration. And then finally, on the last column, we improve with our primary care services, dental services, WIC, and family planning. All these programs are on track and progressing as expected. Our COVID status, according to the CDC's hospital admission metric in Rutherford County, does remain low. We still offer testing at the Rutherford County Health Department through our clinic. In addition to that, COVID testing is also available through retail pharmacies like Walgreens and CVS, as well as our community partners at the Primary Care and Hope Clinic, free of charge to the uninsured, and that's funded through a federal grant. In addition, and this is good news to all, the federal government has reopened the Test Kits by Mail program, with 4 rapid test kits available to every household at covidtests.gov or 1-800-232-0233. And I'll repeat that. That's covidtests.gov or 1-800-232-0233. And any household can call and request those 4 tests to be mailed to them. The Tennessee Department of Health also has a community support hotline that is available to take questions about COVID or the new COVID-19 vaccine at 615-770-6940. That's 615-770-6940, and that's between 8 a.m. and 5 p.m. Central. And speaking of the new COVID-19 vaccine, it has been approved, and you may have seen advertising or notices about it. We have begun to receive our initial shipments of that at the health department. We're just awaiting final protocols and standard clinical practices from the Tennessee Department of Health before we can begin administering those shots in our clinics. We expect to get that in the next few days, and in all likelihood, by the first week of October, we will resume our distribution of free COVID vaccines. That will be the Moderna vaccine, and we will administer those between 8 and 10 or 1 and 3, Monday through Friday, with no appointment needed, and they will be available to anyone 6 months of age or older. On to the flu
Dr.
vaccine.
Cumby, is that
Sir.
a drive up, or do you need to go in?
That is to go in, a walk-in service, yes, sir. Onto the flu vaccine. The Tennessee Department of Health has declared November 1st to be a Fight Flu Day statewide. So flu shots will be free on our health department clinics in Smyrna and Murfreesboro from 8 a.m. till 4:30 on Wednesday, November 1st. Flu shots are currently available on a walk-in basis in our clinics from 8 to 10 and 1 to 3. The Tennessee Department of Health recommends flu shots for anyone 6 months old and older. Flu vaccine is safe and effective and can protect against the most common types of flu and the virus's worst symptoms and outcomes. We will have forthcoming promotional materials and social media shareables about the Fight Flu and available from the state, and we will pass those on to this membership. As always, we like to keep you informed, and we always appreciate you helping us to get the word out to the community. We had a question at our last meeting about opioid overdoses, and I just wanted to bring some data for you on that. As part of our role at the Health Department, we do participate in the opioid fatality reviews, and that is led by the Medical Examiner's Office. It includes law enforcement, EMS, the Recovery Court, social services, and other stakeholders. And we do review cases on a bi-monthly basis and look for possible intervention strategies where we could affect the trajectory of addiction and overdose deaths and possibly help prevent future deaths. And so at these meetings, we're presented with data from the state epidemiologist, and I wanted to share a little bit of that with you. The highest number of overdose deaths in Rutherford County in the last decade occurred in 2021, and that was 122 deaths. That did decline in 22. There were 99 deaths recorded in 2022. And so far this year in 2023, there have been 65 fatal overdose cases in Rutherford County, with 10 of those being this past August. The average age at death was 39.7 years, and 66% of those were males. Fentanyl is still the most common substance found in the toxicology reports. In keeping with our theme tonight about resources, we do have a guest here from the United Way. I'd like to share some information about a grant program from the Tennessee Alliance for Economic Mobility that is available to help Rutherford County families, particularly those who are working, have children, and are still struggling. This grant is special because it looks to address those posed on what is called the benefits cliff, and that may be a new term to some of us. It was kind of new to me, but that is essentially any family who might have the opportunity for a career advancement or a promotion or new employment, but because of that slight increase in income, it could trigger them to lose their benefits and therefore result in kind of a net loss for the family. This grant helps with expenses during that transition period. It offers coaching, counseling, help with utilities and childcare, and budget guidance for the whole family. The grant is called Our Chance Tennessee, and it is allotted for a caseload of 150 families in Rutherford County, specific to Rutherford County. And at the time of their presentation to our Community Health Council about 3 weeks ago, they had only filled 30 slots. So that leaves a potential 120 slots, 120 families that we could help here in Rutherford County that could participate in this program. Just briefly, some of their eligibility criteria are that you must be a U.S. citizen, a household income of $55,000 or less, must be enrolled in a benefits program like SNAP, TennCare, public housing, or even free lunch program, and must reside in Rutherford County. So for more information on that, we urge you to reach out to ourchancetn.org. That's ourchancetn.org. Or you can also contact our friends at the Greenhouse Ministries. They do help administer some of that grant. A brief note on personnel inside our health department. We are moving to reclassify a position that was funded in this state contract, which was approved by this committee last month. There's a position that's currently vacant. We're looking to make that into a nutritionist role in our WIC department. The WIC program does provide much-needed supplemental nutrition to women and children, and due to the continued growth of the county, we serve more WIC participants than any other non-metro health department. And so we currently do this with a dedicated staff of 9 people. We would love to be able to bolster that up, and the state has voiced their support for this move and indicated an amendment to that contract would not be necessary since we aren't creating a new position. We're changing an existing one that is already budgeted for. This role would be, it's already fully funded by that state pass-through contract and of no additional cost to the county. But our county HR director, Ms. Sonia Stevenson, did request that we put that before you, asked to make you aware of our intent before we officially reclassify that role. So we're doing that here tonight. And finally, our administrative supervisor, Ms. Sydney Young, joins us tonight, I guess from the health department, and she has brought with her some information about the new mental health first aid training that is available through our health department. Mental health first aid teaches you how to identify, understand, and respond to signs of mental illness and substance abuse disorders. The training gives you the skills you need to recognize and provide initial help and to support someone who may be developing a mental health or substance abuse problem or might be actively experiencing a crisis. This is an 8-hour course provided free of charge by the Tennessee Department of Health and taught by certified trainers, including Sydney and another member of her staff. At the conclusion of the class, participants will be certified in mental health first aid, and that is available to residents of Rutherford County.
Did you mention a time or date of this 8-hour course, if I missed it?
Thank you for that. These courses will be ongoing probably every 2 months for the foreseeable future. So I should have noted that, and I appreciate that. To find out information about it, get registered for the course, and find out about some prep work that needs to be done on your part before that, just reach out to the health department, contact Sydney Young, and she can put you in touch with that and get you on the roster for those courses. That does conclude our report. I'd be glad to take any questions.
Yeah, thank you. I'll just say how I'm just touched that we can even have the phrase mental health first aid in our language now. It's so overdue, and it's been so taboo to be able to discuss that. I just think that's wonderful. I'm grateful that you've carried us to this status. Thank you. I don't think we need to have any motion on the HR payroll. I think that was information only. Having said that, any questions for Mr. Crumbie? And we'll entertain a motion to approve the report.
Chairman, I don't have a question, but I just wanted to say thank you. Very comprehensive report in the benefits cliff. I know that's something we're going to probably hear about in a few minutes as well. If we're hearing some of the ALICE program information tonight from the United Way, so one of the things I want to say is thank you for bringing that up. I think we need to continue to get information like that to the public, as I was trying to make notes as fast as I can. So is it ourchancetn.org? Is that the best, fastest way for someone that may want to qualify that to sign up, or should they call somewhere? Or do you think that's the fastest way?
I did check the website for a phone number. They did not have one listed there, but there is a registration process on that website. But if anyone is challenged by that portal, reach out to Greenhouse Ministries or reach out to our health department. We'll direct them to Greenhouse Ministries. We definitely just want to make that connection.
Thank you. I know in some of these cases it may just be, I know it sounds unbelievable to some, but not having Wi-Fi, not having a working device that can even get on a web browser to do it, and that's why I wanted to ask about that. Thank you.
One more time. Was it ourchancetn.org? Because it's not pulling up.
ourchancetn.org, and it's ourchancetn.org. It is.
You have service in this courthouse? I can't even get service up here.
I think that's because they get a nonprofit free website from GoDaddy. You can also contact the Tennessee Alliance for Economic Mobility. They proctor this program, or reach out to Greenhouse Ministries, and they are our local contact there. Did you find it? Yes, sir. I did have that same experience as Commissioner Davidson earlier, so I'm aware of that.
I'm going to move on now. We're going there, Trey.
Director, I do have some questions.
Yes.
When you talked previously, because again, that was a very comprehensive report, I wish we could get that data that you share after we get this, because that's much more
would be
robust
glad
to be
to
able to
forward
use
that
that
to you,
and
yes,
have that information. Flu shots begin November 1. That's the big push for flu shots, right?
Correct.
You noted that the health department is still doing COVID testing. Are you actually testing or just giving out the home test?
I'm glad you brought that up as well. We are testing in clinic, but our supply of the at-home test has dwindled down, and the Tennessee Department of Health has let us know that that was part of the emergency process. So they don't look to resupply us on those. That is why I wanted to note that there are other avenues, but we do test in person. Someone would just need to call and say, I need an appointment, and we'll make an appointment in clinic for that.
Okay, and another question, you shared information about the opioid overdose fatalities. Do you have data just about overdoses in general, that where the person does not die?
Yes, ma'am.
What incidence is that in the county?
So for non-fatal overdoses, there have been 315 hospital-reported non-fatal overdoses this year in Rutherford County, specific to Rutherford County. That averages out to about 9 per week, which is actually slightly down from 2022 and 2021.
And does that include the school population? Because just this past week, I've heard of 4 in the school system.
Those are ones that are actually reported by the hospitals. So if, you may have at-home ones that aren't actually transported or things of that nature. The state epidemiologist does provide us with a very comprehensive report, and I would be glad to make that available to you as well. I know this is a concern to our community.
Thank you.
Yes.
Mr. Chairman, I think that the steering committee also gives a report on the update through the opioid committee at their monthly meetings. That's usually the first thing that they do, and it's pretty much Rutherford County statistics. You may look at I think steering meets next Monday or Monday after. Is it next Monday, Rachel? And you may tune into that, because they give a Rutherford County update at the first of that meeting every month.
A motion to approve the report is open, if anyone wishes to make that. Thank you, Commissioner. Second. All in favor say aye. All opposed. Hope nobody's coming here looking for money. We're done with motions tonight.
Thank you.
Thank you. And while we're on the health department, we thought it was appropriate to invite Kristen Swan from United Way Community Support Program. And some of us had the opportunity to be introduced to this program. And Ms. Swan, Commissioner Oliver, Commissioner Wilson were at a meeting a while back with some other stakeholders. Very fascinating, and we're going to give Ms. Swan a couple of minutes to set up. Does anybody need to take, we can take 2 or a couple of minutes if anybody needs it. Carry on. You need a hard wire?
Guys, so much for having me. Is anyone taking a break? Okay. All right, good deal. Well, my name's Kristen Swan. I'm with the United Way of Rutherford and Cannon Counties. Thank you, Byron, for that. He's our friend who's a huge advocate for United Way, so thank you so much. And thank you guys for everything that you do for serving our community. We really appreciate that. So as he said, I really just wanted to share some data and information with you, really regarding the ALIS population specifically, but I also have some information regarding those experiencing homelessness in our community as well. So I think, oh, that was my baby. She's my icebreaker. United Way is really focused on, in 2019, we looked at kind of what are the biggest issues in our community, and affordable housing, which we now have kind of started talking about accessible housing, and also supporting the ALIS population, which stands for Asset Limited, Income Constrained, and Employed. So these are folks that are working, but they're not able to live at the true cost of living. You might have heard the term working poor. That's something that also gets brought up a lot. So United Way Worldwide and United Ways of Tennessee have put together some data for our state that looks at the ALIS population for how many people are living here but are not able to live at the true cost of living. And so this is, an economist kind of put this together with COLI data, which is the cost of living index, and then also just the population statistics from our census. So just some high-level information from the state of Tennessee. Who is ALIS? 54% of fast food workers, 47% of waiters and waitresses, 48% of personal care aides. I won't read to you, but you kind of get the gist. These are folks that are living at or below the ALIS threshold in Tennessee. I will also share with you, I didn't put this number on this slide, but I think it's relevant to this committee, that 9% of educators, early childhood educators, are at or below the ALIS threshold.
Repeat that, please.
9% of educators, so that's elementary and early childhood educators, are at or below the ALIS threshold. In Rutherford County specifically, we have 121, a little over 121,000 households. 8% of those are at the poverty line or below, and 38% are at the ALIS threshold or below. So what Mr. Crumby was talking about with the benefits cliff, this is really where this comes into play. So the poverty line in our country is a federal number. It doesn't change. If you live in Los Angeles, California, or you live in Woodbury, Tennessee, it doesn't change. And so the issue with that is it doesn't really take into account how much does it cost to live in those communities. And so when Mr. Crumby was talking about the benefits cliff, a lot of times what happens is the federal poverty line is what's used to determine benefits often. So for example, free and reduced lunch is 185% of the federal poverty line, or the SNAP benefit is based on the federal poverty line. So in our calculations, let's just say, as an example, a family living in Rutherford County that had 4 people, 2 adults and 2 children, if they made just $50 more a month, they could lose $800 in their SNAP benefit. So let me say that again. If they made $50 more a month, they could lose $800 in their SNAP benefit, and that is the benefits cliff. It's something that I think is a hidden cost of poverty. I think it's something we don't think about. And it's also a reason why there are people who are saying to case managers or programs in our community, I can't make more money, because if I make more money, I'm going to lose my benefits. So this is a very real thing. I see some heads nodding. Just a little bit of breaking it down by ethnicity as well. We do know that this is disproportionately affecting our Black and Hispanic neighbors versus our white neighbors. We have more people in those populations and communities that are at or below the ALIS threshold. And additionally, the single female-headed households in our community represent 89% of those families that are single moms in Rutherford County are living at or below the ALIS threshold, meaning they are not able to live here. They're living paycheck to paycheck. They are basically one disaster or emergency away from being in crisis. This is super hard to read on this screen. I apologize for that, but I will just point out that within the ALIS data, which is available on unitedforalis.org, you can look at it by congressional district, you can drill down by school district. You can really see that in the stability budget, and stability budget just means we're just living paycheck to paycheck. We're not saving, we're not going on vacations, things like that. 2 adults and 2 children in childcare need to make, sorry, I can't see this very well, $77,988 a year to live in Rutherford County, just to survive. If that same family were to be stable, meaning they had room in their budget for savings or things like that, they would need to make $99,528 a year. So that's 2 adults, 2 children, and childcare. Childcare is often one of the most expensive things that a family will look at. So obviously their housing is typically number 1, but childcare is usually a very close second. Any questions about that before I go on to the next piece? Awesome. So I wanted to share a little bit about affordable housing. So when we first start, we have really been talking about affordable housing at our United Way. We all know that that's an issue, but one of the things that we've been talking about as well is accessible housing. So sometimes in our community, even if someone can afford to live in housing, it's hard for them to access housing because they have poor credit, or they have previous evictions, or they don't make 3 times the amount of rent, which is often a stipulation for someone to rent. So it's not just that they can't afford. We have lots and lots of families that are living in hotels, weekly. They are paying a lot. They are paying rent in a hotel, but they don't have first and last month's rent. They don't have deposits, things like that. So our community has what's called a by name list, which is part of our continuum of care, which is all of the agencies that serve the homeless population in Rutherford County. So we keep a list of these are folks that have accessed and been assessed through different agencies. So Salvation Army, Greenhouse Ministries, Journey Home, all of these wonderful agencies that serve our community. This was as of maybe a month or so ago, so it may not be completely up to date, but we had 294 individuals on that list, 98 families, and 48% of those are in emergency shelters or unsheltered. So that list is as defined by HUD. So HUD has a definition of homelessness, which states you live somewhere not meant for human habitation. That is their definition of homelessness. The McKinney-Vento Act is how our school systems define homelessness, and it is a little bit more of a broad definition. So that definition is you're doubled up, you're living with a family member, you're living in an unstable situation, because just because you're couch surfing and you're not literally unhoused doesn't mean you have a stable housing situation. A lot of times those children will change schools many, many times throughout the school year. When we ended the school year, this information is from the Atlas program, I got it 2 days ago. When we ended the school year last year, we had 1,637 students that were identified as Atlas. We currently, as of, I guess it was actually yesterday because I didn't ask her on Sunday, but we currently have 1,037 students that are identified. At this point, from this year to what we were looking at last year, we've had a 45% increase in students that are identified homeless according to the McKinney-Vento definition. So I would invite you all to learn more from her. Her name is Jessica Johnson. She is the director of Atlas. They have a pretty small staff, small but mighty, and she has a ton of information that she could share with you if you're interested in learning more about that. I will also point out for our representatives from the north end of the county that there are no shelter beds in Smyrna or Lavergne. They don't exist. So that is just something to point out, that when we're looking at these, emergency shelter and sheltered numbers, these people are in Murfreesboro because we don't have shelters in the north end of the county. This is even harder to see, but our COC has what's called an HMIS system. So that system looks at the data, so everyone that's being assessed that's experiencing homelessness. And this is a report looking at the previous year, the entire system. So we had 521 households, 738 people that were in that system. Of those people, sorry, I'm having a hard time reading this. We only had 13% that exited from shelter, that exited from permanent supportive housing, that exited from rapid rehousing, any type of housing in our community that exited that. Only 13% exited into a permanent situation. And I think that number is even lower. I believe it's 7% if you're looking at those that are exiting from shelter to a permanent situation. And so I think what that data shows us is that we don't have enough supports and transitional options for people. What Mr. Crumby was talking about, families need a lot of supports, and they have a lot of barriers when we talk about going from crisis to stabilization. This basically just says the same thing, just bigger. I will We'll skip that one because it's very small. So this is another one I wanted to show. We have 736 beds. A bed means just a spot for someone to go. So it could be, you know, a voucher that we're getting someone into housing with. It could be a literal shelter. Only 618 of those are year-round because that 736 number accounts for coldest nights, which shelters people when it's under 32 degrees outside. And so anyway, we have an 85% utilization rate of those beds. You can see here the breakdown, 47% are beds for households with children. 37 are beds for households without children. 5% are for veteran beds with children, and 11% are veterans without children. I believe that's all that I have. I'm happy to share or answer any questions. I will put in a plug too for what Byron was talking about. So Our Chance Tennessee is funded by TANF dollars, and we also have a program that's funded by TANF dollars. It's a little bit different in the eligibility. So if someone didn't qualify for Our Chance, it's a fantastic, fantastic program. Our program may be able to help as well. It's called Launch Point, and we are actually working directly with employers to try to keep their employees at work, because we often know that childcare, transportation, these are things that are keeping people from coming to work. So we want to help with that and help them stay employed. So, all right. Any questions I can answer? I know some of you have seen this information multiple times.
I have a quick question.
Sure.
Has this information been presented to like the Murfreesboro City Council and mayors, that those individuals as well?
No, we have not. No. That's a great idea, though.
I mean, I think all the municipalities,
Sure.
Smyrna, Lavergne, Murfreesboro, because it's all Rutherford County.
Mm-hmm.
And so I think it would be a great idea. So if you need help on that matter,
Yes.
I got you.
I know where to find you.
As a follow-up, how do you get your information out?
Lots of different ways. I mean, one of our primary audiences is local employers. That's kind of, United Way works with employers to raise money for different programs and things like that. So that's one of the ways. We have hosted community-wide events where people can come. We try to promote that on social media and things like that. But yeah, I mean, I think any ideas that you guys have on how we can get this information out there, I'm happy to be there. I'm happy to talk. I'm happy to send you the information so you can tell your friends. But it's also available on unitedforalice.org if you want to promote it to anyone.
That's a great suggestion, Commissioner Oliver, because I do think, and I obviously ask the director all the time, we have platforms with social media, ways to get information out. And one thing I have learned in studying this area over the past year is dignity is very important, and there's a lot of people that will never let you know they need help. They won't let friends know they need help. So sharing on social media, if there's just ways to get out there, how people can get their hands on help, because a lot of people, regardless of their situation today, could still be one paycheck away from food insecurity. So if you would, real quick, because I haven't heard anyone mention it, I think the 211 program is a quick way for someone to reach out for a variety of different needs that might happen immediately, whether it be temporary housing, food. Can you talk about that just for a moment, please?
Absolutely. So 211 is a free information referral line. So you literally dial 211 from your phone. You can also access it online, so there's an online database as well. But if you call or text, there will be a person on the other end of the line who will say, you tell them this is what I need help with, and they will give you a list of resources wherever they are. So 211 is a national number, that it's a national United Way number, so if you're in a different part of the state, you could still utilize it. I will say one thing that is, I do try to caution people, and when they are talking about it, is that it's not case management. So someone's not going to call and I need food and they're going to directly connect. They're going to give them a list of places where they can call to access resources. I just always like to say that because there does seem to be a little bit of confusion sometimes. But it really is, in my opinion, probably the most robust listing of local resources that we have. It's also updated in real time because it's an online database. So thank you for that question.
Well, no, one of the things that Commissioner Murray and I saw, we were somewhere, I don't know, it was at the police station. I hope we were just visiting. But I know we were meeting several different organizations, and I was stunned where Rutherford County has tremendous assistance with a variety of things. People that need temporary housing tonight, veterans programs that need food or housing like tonight. And we kept saying, where is a resource? If we can group together and find a web page or a resource, how does someone quickly find that number? 211's a good one because you can get a list of I need this, and they can call
Right.
and see who can help them. So that's a wonderful start. But I don't know, any movement we could make as a group to try to come up with a resource that somewhere on the county's health department page or somewhere, if someone needs help, if they just knew where to go and didn't have to ask someone, they could hold that, but just go get the help.
Right.
Or if they knew somebody, hey, someone calls, my friend's kicked out of their house, something's happened, they've lost it, how do we help them? Hey, here's a place you can call, here's the website information, and they can give you housing for, to get through the night. I think anything there, we're serving the community. My concern for this being the Health and Education Committee is this is starting to collide. The two worlds are coming together, where education is becoming a place where half our students get food on free and reduced lunches, where we're talking more and more about a majority of our students actually getting mental help from talking to counselors. And I think we're going to start seeing a merging of what's happening in our community, in our schools, and the health department getting closer. So that's why I'm very happy that this committee is starting to really look at both sides of this, because I think if we wanted to or wish it to or not, they're going to start coming together. Food insecurity is one of the biggest things that would stop a third grader from being able to study and read. We talk about reading laws and things. A kid that's hungry can't really study. So we've got to start coming up with ways that we're able to identify this real issue and how we can help as a community.
I agree.
Please continue.
Oh, that's all I had. If anyone else has anything, I will say too, Byron is a huge advocate for 211. The first time I met him, he showed me his 211 binder that he uses to direct people to resources from the health department. So thank you for that. Absolutely. Another thing I will say too about the school systems is we often do present information and share resources with social workers and school counselors. United Way funds actually several mental health positions at the schools. So we fund STARS counselors. We also fund Centerstone counselor at Murfreesboro City Schools. And then we have a partnership with Rutherford County Schools in the Atlas department, where we, through a grant, provide funding for one of their positions. And they have a family resource center at the Boys and Girls Club in Smyrna. So we are very aware of the impact that our schools make. We really believe that it's one of the largest vehicles in our community to make change. And so we try to partner with them as much as we can.
Thank you, Ms. Swan.
Yes, thank you.
We can take that down for you if you. You
Other
can
question?
leave
Oh,
if
you should be okay. I'll just take it.
Any other questions? Thank you. And thank you guys for entertaining this. Those who supported this and encouraged us to put it on the agenda, thank you. And to have, again, I'm going to say this phrase, mental health first aid is such an incredible phrase. And to have that blended with your conversation, and that was unintended. So, and the opioid crisis, and so there's a lot of things are colliding now. And so thank you, and thank you for getting this on the agenda. And my first just brief thought on where we can literally contribute to this is be on the lookout next budget year. We conclude our budgets with the nonprofit supports. So just be contemplating that. Is there a group that we could up the support? Is there a group that's underperforming? We shift support. But that is one way we literally impact nonprofits. So thank you. Moving on, community care, the reports, the minutes were published on the SharePoint, so be on the lookout for that. And no, I have no other report from that. And finally, we do have an item, special reports, report update, Finance Director Michael Smith. Michael and I have not discussed this, but if you have new information, wonderful. Thank you. Thank you. Trey get one?
So I don't necessarily have any new information, but I wanted to give you updated information as far as we've been working on getting all the reports updated. As you know, we're going through our audit process now. But we did update this report as of today. So I know Dr. Sullivan talked a lot about the school projects that are ongoing. And so this is every school project in Fund 189 that is ongoing, that has been approved. So a little bit about, I just want to, if you look on the first page, looking at Lavergne Middle Annex, I just want to kind of tell you about the way this sheet works. So it's going to be the same for every project. But the two columns that to pay most attention to is the second to last column that's going to say not obligated, and the one that says not expended. But the one that's most important is not obligated. That's going to be the remaining funds that are not budgeted, not obligated to a project, that let's say as we finish projects, a lot of times we'll come up here and move funds that we had saved for another project to another. That's the column we generally to focus on. That's the ones y'all would have an option to move. Not expended is just cash. And so one of the things I want to point out is a lot of times what you'll see is not obligated, not expended will match as they do on that project. And it's highly likely that project is done or right at being finished. And so it's generally like Lavergne Middle, the school board will eventually move that money, $355,000, to another project. I would say very soon, but they would have that ability. And that's going to be the same kind of all the way down as you look through there. One other thing I want to point out, if you'll flip to the very last page, so the very back on page 4. And this is one of the things that's going to be a little unique, is that right now, if you look at the total for not obligated right there, it's showing a negative $131 million. But that's because we have not issued our bonds yet. Our bond sale is tomorrow morning at 9:30 in the morning. So I'm going to touch on that a little bit too. We've not had great news this week on interest rates. The 10-year Treasury has went up quite a bit, and the stock market as a whole has kind of went down several percentage points. So our anticipated interest rate has ticked up quite a bit, but we should know tomorrow what the true interest cost to borrow that approximately $180 million will be. So sometime by lunch tomorrow we'll know, and I should be able to report that to budget next week. But anyways, that $154 million for the 3 high school additions, once we're able to move that funding in there, we'll take that where that's not a negative, not obligated. And as you'll see down there at the bottom right, there's $35 million, and that's that to get to the $37 million we have in that fund in cash. That's where the commission approved the $35 million bond anticipation note back last fiscal year. So that's kind of us reconciling there. But I'll give you a second to kind of flip through those projects. I'd be happy to answer as many questions as I can from the county's end. I have shared this with Dr. Sullivan and with the school system. The other thing I will point out on here is we talk a lot about shared and unshared money. And so you will notice a lot of things on here that we've labeled elementary, future elementary. We've kind of separated that out. Like under the land, you will notice we have elementary and secondary, and that is we have to keep that shared and unshared money separate. And I do hope to get back. Everything's kind of funky at the end of the year with timing, but hopefully we'll get back to having these on your iPads every month for this meeting.
Just a real high-level question. The first few items do indeed match, which suggest the last 2 columns match, which would suggest they're nearly complete. Have you heard of any dialogue on where this money might be going? Has there been any? Does the board discuss that at all? So
no. One of the internal conversations, and I'll tell you from working in a school system previously, the first one right there, that $355,000 for Lavergne Middle. When we're talking about building a school, an elementary school is at minimum, $40 or $50 million potentially before you have to share with the city. So a lot of times that money will be funded for future design, and so with that being secondary money or doesn't have to necessarily be shared, or a portion of it doesn't have to be shared, that would be something we'd probably shift to the design of a middle school or a high school or something like that. And then you'll notice land there is the next one. So that one's a little unique in that, yes, that money could be moved, the secondary money could be moved to any secondary school, and the elementary money could be moved to any elementary school. And as you see, on that sheet, we just bought elementary land, the Beatty property on there. So that you could move that 900,000. A lot of times I would recommend that keeping that for land, just because if a deal pops up, or something. And then you'll notice there's not a lot left on Plainview Elementary. As soon as we close out that project, those little small amounts, we just move those into the nearest elementary. But a lot of times that money gets moved for the design phase. I believe this body moved last fiscal year as well, 900,000 for the design of the new elementary school, and that came from leftover money from projects like these.
These dollars are ours to move or the Board of Education's to move?
So
ours being the county commission.
So these dollars are up to the Board of Education, subject to somewhat of y'all's approval. And I say that as in the Board of Education cannot move these funds out of this fund to something else. But it's been settled, and I'm trying to say this very cautiously, but the commission's job is to fund a school, but based on court precedent, the commission cannot say where to build that school. So they would come and ask to move the money from maybe, if they have leftover money in Oakland High School, to go buy land for Oakland High School. Your vote would be for the budget portion only, not for the location of that school, if that makes sense. So your vote at the commission level is only to fund. So the county commission would have no say in where that school goes. Zoning, building schools, locations is up to the school board. I'm kind of looking at the school board's attorney. I hope you don't get mad at me for speaking in legal terms, but your vote is to only fund the projects or the schools, not for locations or to prioritize the project. That would be up to the school board. But everything in this fund is bond money. So
what money?
Bond money. So you're somewhat restricted on what the bond was issued for as well. But I hope this helps. It gives a detailed breakdown of each project, and then kind of how that money's being spent.
Well, please go ahead. Thank you that this is the first, I think, reconciled and a good explanation. So nonetheless, thank you for that. And with this in hand, we can be more prepared to scrutinize going forward.
Like I said, I hope to have that every month. Like I said, we had it right around the fiscal year. Things get kind of wonky where we're paying bills in July and August for bills that were received in June, and booking payables and receivables. And then also with the issue of a bond anticipation note that we have out and our bond sale, there's a lot of moving pieces right now, but I did want to get this to y'all as quickly as we could.
Oliver?
Yes, quick question. So when the last two columns are not equivalent, what does that mean? So you have not obligated, but then not expended is greater than what's not obligated.
What
explains those differences?
So let's find one here that would be a good example. Okay, so a lot of these projects are ready to be closed out, but let's flip over to, I'm trying to look for a good one here. Let's flip over to Rockville Middle. So if you're going to look on Rockville Middle, there's not obligated is $983,000, but not expended is a little over $1 million. What that's saying is I have a little over $1 million in cash in the bank, in the trustee's office, in our operating accounts. However, some of that money is obligated. We just maybe haven't gotten a bill to a contractor yet. So I would advise, this body or the school board that you could only move 983 somewhere. That other money is essentially reserved. It's part of that contracts to date column where we're looking at, maybe we hadn't gotten a bill, maybe there's a punch list item out remaining, we're holding some money. And if you kind of look up there at the top, I've kind of labeled the columns A, B, C, D. And so if you look at not expended, I'm taking the budget minus expended to date there. And so the not obligated column, I'm taking the budget minus contracts to date. So, for example, when we do these when we get the bond money in for the high schools, you're going to see a super large not expended amount. You may see $20 million that we haven't spent on the high schools additions, but as far as not obligated, it may be $100,000 because we haven't received bills. Does that help?
Wilson.
Thank you, Chairman. Actually, I have a question to ask Michael once we're done asking questions about this. It is related, though. It is about the funding.
Any other questions on the progress report? And I don't think we need a motion to approve this report. This is informational. Would you agree? Okay. Get him questioning while you got him.
Thank you, Chairman. Actually, I've had several conversations since our last commission meeting. Michael is here and captive right now. Can you give a brief explanation, as simple as possible? People have a really hard time when they're listening to our meetings understanding shared money. So there's a couple different things here. Obviously, the county receives money in a couple of different ways. We receive revenue. We get money from the state, obviously in revenue through property taxes. When that money is split and how it's split, we know the argument that we had the other day was we're spending money out of 141 to do something, and that is shared money. People are still very confused. So could you just talk about when the money is shared? The money comes in from all the revenue sources. When is it split? Just so we can get that on the record and send people this video to watch it.
So all local revenue that goes to education has to be shared based on the ADA rate. Now, what that rate is, it's going to be an average daily attendance rate. That rate for us right now is approximately 84% county, 16% city schools. It varies every year. We get a new rate every March, and it's backdated to July 1st of that fiscal year. But notice I said all local revenue that goes towards education, except one or two very, very small caveats. So, for example, sales tax. A lot of people always wonder where their sales tax goes. So when you pay sales tax in Rutherford County, whether that's in a municipality or in the county non-incorporated areas, half of all sales tax goes to education. So then half of that sales tax that went to education, 84% goes to the county school system and 16% goes to the city school system. But that's all local revenues. So, for example, we have a mixed drink tax that's a local revenue, or property tax. So when this body votes on the property tax rate every year, the portion that y'all vote to go to the county's school system's general fund, that money is split based on that ADA rate. Now, I want to caution, because a lot of people go look at that ADA rate, it is weighted. So you have a higher weight on that ADA rate for a special education, for an ESL, English as a second language, for a CTE student, all sorts of things. So that ADA rate is not going to be your attendance rate that Dr. Sullivan read you tonight. So, for example, you may show Murfreesboro City, I think at one time had 8,000 or 9,000 kids. Well, their ADA rate was over 10,000 because of some of those weights. Now, Rutherford's ADA rate may show 52 or 53,000 kids. I don't know. I don't see that on a daily basis, but I just want to give that some perspective. Now, with that being said, is that ADA rate is based on essentially the number of students between each district. And so with Murfreesboro being a K-6 district and us being a K-12, and I'm excluding preschool because that has some different requirements, we only have to share the portion on the ADA rate, which is based on them having K-6 through sixth grade. I believe they still have kindergarten. So with that said, if we issue a bond for a high school, we don't share that. We keep 100% of those bond proceeds. But if we go borrow a bond, if we need $50 million for an elementary school, we may have to borrow 60. I'm throwing out a number. Don't math check me at home. We may have to borrow 60 million and give 10 or whatever, that 14% of the total bond issuance goes to the schools. So there's a lot of talk. I will say it's probably going to be my recommendation. If there's a high school project, I'm going to recommend some of that come out of 177, or essentially unshared money. And if we're going to do, for example, the design of the Beatty School property, this body approved $900,000 for that, and it came out of already shared money so that you didn't have to borrow for that. Because the other downside to that, yes, it all goes to education, but if you go borrow that 60 million, we give 10 in my example to the city school system, we are paying interest on the full 60. And so that's what you're really trying to avoid. And I think one of the examples that was given the other night, all money that goes into the counties or the county school system's general fund, their Fund 141, is shared. So I think there comes a lot of debate. Yes, it has a lot of money in that fund compared to maybe 177. So you really have to be careful about how you spend it. Now, sometimes you just have to spend shared money because that's the only money you have, and that's okay. You know, sometimes the need is so great, how I've talked about tonight at Lavergne High School or Stewart's Creek, you know, but it took, to get into that fund, 14% came off the top to get into Fund 141 from a local revenue perspective. I hope that helps. I know it's kind of all over the board there, but that's it. I tried to give it as plain, Jane, and simple as I could.
As a follow-up, your last statement, you said, prior to that money going into that fund, it's already shared, correct?
That's correct.
So when you're using that fund for whatever you're using it for, it's not about it being shared again, because it's already been shared. Is that correct? I'm just curious because I've heard my colleagues talk about,
So-
well, no, that's shared money, but I thought, in my mind, prior to it going into that fund, the city already had what they were going to get dispersed.
You were correct. So you're 100% correct on that. That money is already shared in Fund 141, but what you're talking about is essentially you're getting 84 cents on the dollar in that fund, right? So let's say, for example, we're going to do these high school additions. You know, so let's say we're going to do an additional at Lavergne High School that was talked about tonight, and you need $20 million. And so let's say you got $20 million in Fund 177 and you've got $20 million in 141. You know, both $20 million, one's shared, one's not shared. That $20 million to get into 177 was exactly $20 million put in there to get that. But that $20 million that went into 141, 14% came off the top. So you had to generate more than the $20 million to get into that Fund 141. So you would be more advantageous to take the $20 million to kind of get a dollar for dollar return on your money out of 177 than you would to pay for that high school out of 141 if you had the option.
And just because you're doing a great job, this is great. Hey, people, go watch the video from this particular day. You're doing a great job.
Like my mind, or the math.
Just a couple of things. I'm just filling in some holes because this is so good. What's the one way we get money into 177? Because the sales tax goes directly to 141, and the money coming from the state goes into general foods. So how do we get money into 177?
So the two main, off the top of my head, I think there may be two other small ones in there. There are some small ones, but the two main ones are going to be property tax and our school facilities tax goes in there.
Property tax has been a nickel, went to 7.5, went to 11. We've pulled, the school board contributed 5 cents so I mean, but the nickel has kind of been something we've tried to hold.
That's one of our issues in trying to pull from 177 during the budget year. We already, for instance, this year was about $18 million. We had already budgeted to go into 177. And of course, all of that was stuff already we were hoping to spend. That was money we asked for. So the problem going into 177, which is our conundrum, is the amount of money we have budgeted to go into it is already spoken for what we want to do. And that's where that debate came from. That's why I wanted to bring it up. I had several people paying attention to the meeting saying, I don't understand shared money and what that means. If it's already shared before 141, then it's already free and clear. And I said, I think the spirit of it is, since you could use that towards elementary stuff and it's already shared. When you use it towards high school things, you just have to remember that you could have done it through a different method like a bond and used all the money. It just depends. The problem is it depends on what the need of what they want to use it for, and if they don't have the funds for it, that's what created two different deals. We had the South Church thing, then we had the that as well.
And keep in mind, without Dr. Sullivan or his finance staff here, you know, I think one of the things too is Dr. Sullivan's new. They have a new school's finance director, a new assistant finance director over there within the last, 12 to 18 months over there. And so I think we've had some really good conversations between my office and the schools in the last 2 to 3 months about really how to try to be strategic and make our dollar go the farthest for the county. And so I think as you go forward, you're going to see there's a reason to, I think as we look at renovations for the new Church Street property, as we look at building a new elementary school, I think we're going to try to be creative. And I mean that in a good way, not creative as in Creative isn't trying to stretch that dollar for us so that we're using shared money at the elementary. So we may be coming to y'all, moving some projects around that are in that 177, maybe moving some of that to 141 so that we can take advantage of that 141 already being shared. And so hopefully you'll see that over the next 3 to 6 months going forward.
Thank you, Michael. And that's what I was wanting people to hear is we have a budgeted amount already in 177. It's not like we can find new ways to put new money in there. So you just said something really great. It's, hey, if there's some things that can come from 141, then that frees up 177. You would think, man, thank you for taking the time and answering that question. I think that's helpful for everyone that listens. Thank you very much.
And I'll add one thing. That 177, that's a budgeted plan for them. But that is subject to the school board's priorities as they look through that. You know, that they make that budget kind of request every year to this body based on that number of projects. But just coming from a school system prior to here, it's very fluid because I believe at one point this year we had a light pole. Was it Smyrna, Lavergne? I'm looking kind of at that fell, and so that's going to jump to the top, right? So it may move. Maybe painting a wall is going to move maybe to the back burner of something that's an emergency or an ADA concern. And so I think, yes, that money is already budgeted, that 17 or 18, I don't know the number off the top of my head, but that money is fluid, does give some flexibility throughout the year to, one, either move priority items to the top, or two, do what you just mentioned, which is shift some money between 141 and 177.
And Commissioner Wilson and I have been reluctant, and Commissioner Oliver and others, to don't touch 177. We've got, those needs are too great, so thank you for that clarity. If we can, we need to be guided to be creative as well, so thank you. I think that's a dismissal. Thank you, Michael. Any other business? Commissioner Phillips? Oh, you're putting your mic away. I thought you were picking it up. If there's no other business, I'll take a motion for adjournment.
So moved.
Meeting adjourned.